And we are live. It's Dr. J here in the house. Today we're going to be talking about Candida and brain fog. I did an in-depth podcast on this topic today, so feel free, click down below so you guys can access that great podcast. So Candida and brain fog, what's the connection? We're going to go into Candida, why it's driving brain fog, and how to look deeper at Candida. Is it an issue with you, or is there something else that's bigger? All right, so let's dive in. So what is Candida? Candida is a yeast. So you kind of have this big umbrella of fungus, and yeast and Candida are under that umbrella. And Candida albicans is the most common kind of yeast. Like you'll see it with seborrheic dermatitis or even dandruff in the hair. That's yeast issues. You may see it with tinea versicolor rash, kind of a blotchy kind of skin rash. You'll also see it, of course, with like jock itch or athlete's foot or a vaginal yeast infection or the white-coated tongue in the mouth. That's thrush. These are all yeast issues. You'll see maybe on toenails and stuff. You'll see the thickened, yellowy, discolored toenail. These are all potential Candida issues. And Candida is definitely a stressor in your gut. I mean, it's going to create stress in your gut, which automatically does a few things. It's going to create a fight or flight response and make it harder to make enzymes and hydrochloric acid. It's also going to rob certain nutrients and B vitamins, especially B1, and it could potentially affect digestion of other amino acids. Right? Amino acids are what helps you make a lot of your brain chemicals. This is why when you have a gut issue or a gut bug or a gut infection, it can affect your mood because of these nutrients aren't getting into your body so you can make the building blocks. B vitamins are really important. B1's very important for mood and for energy and for mitochondrial function. And then, of course, yeast spits off various mycotoxins. These mycotoxins can cause mood issues. They could disrupt digestion. Acetaldehyde's also another byproduct of yeast. And acetaldehyde is stress on the liver. It's actually what's produced during alcohol as well. And that acetaldehyde can create these compounds called cell solenols, which can go to your brain and can affect dopamine production in the brain. And dopamine is really important for cognition, for focus. It's part of that reward neurotransmitter. And then also just the gut permeability aspects that can happen with a yeast overgrowth. Gut permeability means your tight junctions open up a little bit. You're going to have food slipping in, various biotoxins or mycotoxins or endotoxins slipping into the bloodstream, moving their way through the astrocytes in the brain, and that's going to create an immune response. Your glial cells will get activated, and that will throw off your immune system. And as a result, a lot of times cognitive issues will happen as a result. It's very common. And so what causes a lot of yeast issues? Poor diet, lots of refined acellular carbohydrates, antibiotic use, birth control pill use shifts the pH of your urinary and vaginal canal, which can create yeast issues. Anytime you do an antibiotic, you're going to have a rebound fungal overgrowth if you wipe things out too fast, and that can create a fungal overgrowth on the backside of it. Very possible. And again, when you affect nutrition, absorption, your immune response, poor digestion, not being able to get the vitamins and minerals or break down the proteins optimally, it's very possible that you're going to have other symptoms as a side effect. And we go kind of deeper into the podcast on that. Now, how do I personally test for Candida? I'm going to look at clinical symptoms. I'm going to look at, do you have a white-coated tongue? Do you have any fungal nails or toenails? Do you have any history of recurring yeast issues or athlete's foot or jock itch or seborrheic dermatitis or dandruff? These are all important things to know because clinical stuff matters, because sometimes you may not see the lab indicators you need, but the clinical indicators are right in your face. And they don't really cost anything. They're just right there. You just have to know what to look for. Now, on the laboratory testing, we may look deeper at blood work. Candida antibodies, IgG, IgM, IgA are helpful to look at more systemic things. We may look at organic acids, diarabinitol or tartaric acid or various oxalates that are elevated. Could be a sign of increased yeast. We may also see it in the stool. Sometimes you don't see it in the stool though. So just because you have a stool test and yeast didn't come back or Candida didn't come back, you could still have it. So that's not always a given. The organic acid test helps. And then just looking at clinical symptoms can also help. And anytime I create a protocol to deal with an infection, I'm always kind of making an assumption that there probably is Candida or something else that may have been missed on that test. So we always keep that in the back of our head. So in case we're creating a protocol, we don't miss something. There's still a little bit of overlap support on the program to help knock out any yeast that may be present as well. So we kind of have all those markers we want to be looking at, so we have a nice big umbrella to catch anything that may be kind of falling to the side, so to speak. So kind of in summary, right, we're changing our diet. We're doing deeper lab testing. We're seeing a clinician that's going to look at the bigger clinical picture. And also we may want to look for other things besides Candida, because H. pylori and other parasites and bacterial overgrowth may be present with yeast overgrowth or small intestinal fungal overgrowth, SIFO for short. You could have SIBO along with it. You could have other parasites. And not to mention, a lot of people that have chronic infections, they have a lot of hormonal stress. So they're not able to regulate inflammation or heal and recover as fast. So coming in there and just doing a whole bunch of killing can actually create more problems. Doing a lot of antifungal medications, the research has shown that it actually causes, you'll knock down some of these things, but you create a stress response in the Candida where they'll actually replicate and they'll mate more and they'll multiply more as a byproduct effect on the flip side. So you got to be careful of that. You may not quite get that with some of the natural components, partly because the natural components also have a whole bunch of antioxidants. They support the immune system. They also have a lot of antioxidant compounds to help with the oxidative stress of killing everything off. So you get a lot more benefits from an oxidative stress, from a nutrient standpoint. And also the fact a lot of these herbs have been used for thousands of years, especially in different cultures. And a lot of times certain foods have been added to, certain spices and herbs have been added to the food kind of like as a preventative maintenance thing, like ginger, or you may see it with thyme or oil of oregano, where these spices are used more frequently almost as a preventative maintenance. So that's kind of cool to see that. So recap, if you want to dive in deeper with any yeast issues or gut issues that could be partly connected and could be part of, the problem with the brain. We see increase in schizophrenia with Candida issues, especially in men. We see also mood issues, energy issues, cognitive issues, and all these things are going to affect how you feel, your focus, etc. Hope that helps. Feel free to click down below to schedule a consult with myself or to dive in deeper. Let's see if there's any questions here, y'all. What's up today? What do we got? Try to keep it to the topic of Candida if we can. Why do you stream on YouTube when screens are bad for our health? Well, because I got to get the point across, and the social media is one of the best ways to do it. Also, invest in a good monitor. Like I have the ViewSonic monitors. That's a low blue light and a low flicker monitor. They work phenomenal. Just got my eyes examined yesterday, and my stigmatism was actually 30 to 40% better, which is great. So I think blocking out some of the blue light and going lower flicker, I think really helped. Excellent. Yeah, the radiation given off by your screen isn't anywhere near the damaging wavelengths, correct? Not that big of a deal. Plus, you can control the intensity on your phone and get a set of blue blocking glasses. All that's great. Excellent. Okay, good. Keep rolling. Is there a connection between Candida and cancer? Yeah, there's an Italian research. I think Dr. Simonelli, something like that, Simonelli, and he did a whole thing with Candida and using baking soda to kill it. So there may be a connection with Candida and cancer for sure. Now, a lot of people that have cancer that are like immunocompromised because of radiation or because of chemotherapy, they can get significant fungal infections that could kill them, but it's not the fungus typically. It's the major compromised immune system because of the medication and the treatment that does that, though. Good question. All right, any other questions, y'all? Let me know. I think I hit that one. Can Candida cause severe damage in organs when there are overgrowth? It's possible. I mean, you're going to really get the major overgrowth in areas when you have a major compromised immune system. Okay, what forms of household fungus are harmless and which ones are dangerous? Mold in bathrooms, refrigerator, cook food on fruit. Well, I mean, anything in the home from water damage is not good because they can produce mycotoxins like ochratoxin or ochratoxin is really one of the big ones, but there are other ones. There's like hundreds of them, but ochratoxin is the most common one, and they can be very immunotoxic, neurological toxic, really a big stress on the body. Of course, food's a little bit different, but same thing. You don't want to be having any fungus at all visually that you can see. Mold on the bathroom and stuff isn't as big of a deal because, usually your bathroom's set up where it's tile or some kind of a laminate so you can rinse it off or use some kind of an essential oil or some kind of a killer or a Tilex. Even if that's not the best one, you can at least kill it. And it's in an environment where it's not going to rot like wood or drywall. So it's just a better environment, but you still want to knock it out. Can Candida cause acid reflux? Yeah, it definitely can, because it can disrupt digestion. It can disrupt stomach acid, and it's possible you could have H. pylori along with it, right? You don't just have to have one issue. It could have multiple. It can be multiple issues. Can Candida infections cause iron deficiency? Yeah. Excuse me. Yeah, if Candida's bad enough and you have enough gut stress and your stomach acid's low enough, it could possibly create an iron issue where you're not able to break down your iron properly. Yeah, it's very possible. Again, if you're eating red meat and you're digesting it, you'll probably be okay. But if your digestion's really messed up, it's possible. Is coffee bad when a person has Candida? I would say it's probably okay. Just make sure what you're putting in the coffee isn't excessively sweetened. My dad's 88, is mild Parkinson's, moderate dementia, toenail fungus, dandruff, bad skin, bad breath. Testing is not possible. What is the best way to proceed? So first, start off with the diet. If you can't control the person's food, then it's going to be an uphill battle for everything else. Start with the food. Candida is a yeast/fungus. How long does it take to fix mold in the body? It depends. Did you get to the root cause of the mold? If there's mold in your house from water damage, did you fix that? Is that fixed yet? It's all about getting to the root cause. And then from there, it may take a couple of months to a couple of years, depending on how long you were in that moldy environment for. What kind of natural remedy do you recommend for scalp or dermatitis, dandruff, super positive IV Candida problem? So there's a couple different shampoos and stuff that are out there. Maple Organics, Pure Naturals, ART Naturals. They have some pretty good products that are typically tea tree based or even some coal tar based. They work pretty good. What a traditional GI do an endoscopy and see yeast overgrowth or test for it? You're not going to see it unless it's incredibly overt. Now, you may see it in the mouth, like the white-coated tongue, or you may see some of the fungal rashes, like a tinea versicolor. Obviously, a jock itch is pretty noticeable. A vaginal yeast infection can be cultured. So some of those are easy to assess or test. Obviously, fungal toenail. In the gut, not as much unless there's a significant immunocompromised issue like cancer or some kind of AIDS or HIV issue where the immune system is really weakened. Then maybe you'll see it. If not, it could be more in that subclinical kind of realm. Excellent. Is thrush on the tongue dead or live Candida? I would say it's probably still alive. If there's a white coating there, I would say it's still alive. It's probably not dead until it's gone. What is the best probiotic for Candida? Well, I mean, just having good beneficial probiotics like Lactobacillus and Bifidobacter species are going to be helpful. You can also add in things like Saccharomyces boulardii, which does help crowd out a lot of the Candida and can help bump up your immune response, and it can actually crowd out things like H. pylori and even Blastocystis hominis, which are very helpful too. How long does it take to get rid of Candida? It can take anywhere between months, typically in the month side. It just depends upon how good your diet is, how bad it is. Are you making diet changes? Are you fixing your digestion? Are there any other infections beyond just Candida? Sometimes people have Candida because they're living in a chronic moldy environment, and the mold from that environment is making it hard for that Candida to be resolved. Sometimes the environment is a big part of the puzzle, and it's good to keep an eye on that. All right, excellent, very good. All right, wonderful. Any other questions, feel free to let me know, y'all. I mean, you guys are asking some phenomenal questions here. Really appreciate it. You guys are doing a wonderful job. Outside of that, feel free to click down below. Feel free, you need to reach out to myself or my colleagues. We're here to help you if you have any gut issues that are chronic and you're trying to put the pieces of the puzzle together and figure out what's going on. That's what I'm here for. If you like the content, thumbs up. Put your comments below. Let me know about what your experience with Candida is and what you've noticed, what's helped. That helps me to learn, and it gets the information out there. Last question here. Is it useful to know which part of the body the fungus has been taken up, i.e. the gut, the brain, the heart? Also, how much does the location impact treatment? And well, I mean, you have superficial, which is like on the skin or on the toenails. That's helpful. Mouth. We kind of assume if it's there, it's probably somewhat in the gut as well. The exception may be feet, just because people can get fungal issues because they walk in a public facility, restroom, or public pool, or they wear sandals or things like that. You know, that's easy ways to get it where it may not be a systemic issue. Outside of that, we would do gut testing or urine testing or blood testing to know if it's more of a systemic issue. Would antibiotics for treating suspected Lyme make Candida worse? Potentially, yeah. If you're doing like a doxy, things like that, yeah, it definitely could especially if you're not addressing the gut issues or using probiotics. It definitely could. All right, y'all, have a phenomenal day. I am out. I'm going to be actually creating more content for y'all, so stay tuned and look for those uploads. All right, y'all, take care. Appreciate it. Sharing is caring. Bye now.